There's been a lot of concern about the headlines that are coming out, not just the number of cases, increasing cases that we've seen, but even Houston's mayor came out yesterday and said that if we don't change this trajectory, that your hospital system is going to be facing some serious issues in 2 weeks or less. What are you seeing on the ground right now?
Well, that's an apt description. I mean, if you look at the period of time, say from Memorial Day to the end of June, we've seen a fourfold increase in the number of people that are going into the hospital every day. Another way of saying that is you hear a lot about positivity rate, the number of people that are being tested that are positive. In the city of Houston, that number is on the order of 25%, so 1 in 4. And that's relative to a number that you'd like to see to have a more stable situation of 5%. So it's a pretty serious situation. As the mayor said, the hospital situation, we've already full with our normal ICU capacity. That can be expanded, of course, and that is being expanded. And so we have potentially another 2 weeks if we stay on this same trajectory before we get into what I would call unsustainable surge capacity. You know, you start to run into problems with staffing and a number of other elements. So it's a serious, very serious situation.
Marvin, Governor Abbott did declare on Thursday that masks are mandatory at this point. Have you seen an increasing number of people on the streets who are willing to wear the masks?
Oh, absolutely, and and that was an important message to everybody in the state, because you can look at this. It really comes down to individual behavior in the end. When you think about the toolkit that we have to control this virus, it really is just so very simple. It's wearing a mask to protect others and to protect yourself. It's keeping a distance of something on the order of 6 feet. And that's really it. So, I mean, if every individual would follow those very simple rules, this kind of spread would not be happening. So we need to continue to emphasize that point. Communications is a big part of this program to help people understand that. If you can get people to do that and implement the programs which are already existing around testing and contact tracing, then you can control, again, the spread of the virus. But without that participation of individuals to do those simple things, it's a very difficult thing to control.
Where is Texas right now, both in terms of the testing for coronavirus, but also the contact tracing? Because from what I hear from some people, you know, the United States has not done a great job in terms of trying to make sure they find everyone who has been exposed and try and make sure that they quarantine.
Well, the simple story is we need a lot more of both. So let me just talk about testing for a second. We've gone from a program that was constrained by supply, if you will, whether it was PPE materials or some of the reagents that were needed. So by the time we got to about the end of May, we were able to expand our capacity quite significantly. So we went from these very large, centralized, federally run sites to think of 2 of those in the city of Houston to on the order of 27 sites that we spread out across the city, mainly to address our vulnerable and at-risk population so that we went to the right place. And we made that testing free and more accessible to people. Now, that was actually working very well. If you look at where we were at the end of May, that capacity was getting to the point where I would say was pretty accurate to start to understand what was happening in the city and to direct our resources to the right place to control that spread. But then as we started to see this dramatic increase a couple of weeks after Memorial Day, now all of a sudden testing is short again. When you have 1 in 4 people testing positive, it's hard to build enough capacity, certainly in this period of time. And I would say it's really a very similar story with contact tracing. So when a virus like COVID-19 is in control, you're managing that virus at a quantity that is manageable, then you can build a testing program and a contact tracing program to help contain that. When it's spreading virtually out of control, it's very difficult to have enough of those resources to contain it.